ladies and gents. This morning we're going to do cholesterol testing. Now, there are a couple of things which are extremely important. Number one, you've got to remember that we're going to be working with blood samples, so you can very easily pick up a disease from the blood. Okay? Main problems that you've got, HIV, hepatitis, and a couple of others. But those are the two main ones. Okay? What we are going to supply for you guys is we're going to supply you with safety lancets. Now the safety lancets you're not supposed to be able to prick yourself with, but students can do funny things. Okay. Something else which is critically important, if you are working with a machine, you must always compare the machine to the test strips that you are using. You will see that on these strips there is a code there. That programming code must be the same as the code on the chip of the machine. When we set up the prac for this morning, there's one set on this side, one set on that side. Don't mix the stuff up. Okay, check the codes. The container should also say cholesterol because that's what you're testing. Make sure that you don't use the wrong strips. The cholesterol is printed in blue and the programming strip is printed in blue. Okay, so that is very important. Step number next is going to be to take the sample. I'm going to show you how the procedure is. I'm first going to just explain the basics and then I'm going to show you how to do it. If your patient is right-handed, you always test on the left hand, the non-dominant hand. If your patient is left-handed, you test on the right hand. Okay? You always use the fingers that you don't use most, because otherwise you're going to keep on knocking and touching and whatever the case might be. So, never use a thumb, okay, because you use it all the time. Never use your first finger or your pointing finger, because some people use it to scratch their nose, okay. Pinky is too small, which means that you're stuck with these two in the middle, okay, these two, okay. For the guys, if you would like to have the girl's telephone number, tell her you would like to test their ring finger because it goes directly to the heart. Okay. Next, if you test and you are pricking, don't sample on the tip because there are too many nerve endings there. It is going to hurt. Okay? So you always sample on the side of the finger, okay? But don't go back further than the nail bed. Okay? And a little bit to the bottom side, not too far. But if you hold the hand, you've got to be able to do the hand like this. The other reason is that you need to be able to get the drop. If you prick on the other side, you're going to have a problem with not only pricking but getting the sample. Okay, so procedure goes like this. Step number one is to load your test strip. Well, actually there's something I just forgot now. If you're going to be testing yourself, you can do it without gloves. If you're going to be testing somebody else, you must wear a glove. Okay. So for today, I am going to try to test my wrong hand. So I'm just going to put the glove on for now. Step number one is test strip goes into the machine. The moment you put it into the machine, it's going to come on and it will show you the code and you can double check the code against the container. Step number next is you need to get the finger ready and you need to swipe that and get that area disinfected. So you take the glovey, you tear it open, the envelope, finger, I'm going to do the ring finger in this case, you wipe it off, okay, make sure it's nice and clean, and then you ask your patient to shake it. But don't let them shake up here, let them shake it while they are holding it down, okay? And don't let that finger touch anything. So you shake it down. There are two very important reasons for doing that. Number one is to evaporate the alcohol, because if you are pricking and there's alcohol on there, it is going to burn. The other reason for doing this is if you do this, you are increasing the blood flow towards that finger. Understand it? Okay. Then your pricker looks like this. You have to twist the cap off. You turn it like an Oreo cookie. Okay? Then you pull it out. Okay? Please note that there are different containers for the waste. We're going to come to that just now. Your finger, if you are brave, you can hold it in like this in the air. If you are chicken, you put your finger down on the bench so that you can't pull it away. Okay. Take this, you prick on the side of the finger before the end of the nail. Okay? If you do it correctly, the person should not feel anything. Okay? Now, theoretically, the blood is going to come and walk running out of there. Guess what? It doesn't happen. Because your body, if something penetrates, it contracts. Okay, you can try to hold it down, but don't shake. Because if that person starts shaking, the blood is going to go all over the place. Okay. So my honest opinion, you start milking, this is what they call it, at the base of the finger, and you press down. But you need a reasonable drop of blood. Then on the strips, some of the strips have got a sampling on the tip, these ones are on the side. So you need to hold it. You need to hold it so that the capillary will actually suck the blood up into the little tube on the strip. Once it's full, it is going to say teeth, and it will start on a countdown. Okay, put the machine down, let it rest. You take your swabby, put it on the blood, hold it there, wait for the blood to coagulate. In this case, my results just came through 4.0. Okay, 4.0. So now you need to record this. After this, you've got to dispose of everything. First of all, this is a sharps. Even though it's a safety sharp, it needs to go into the sharps bin, which is this yellow container. Okay. Anything that is contaminated with blood needs to go into a biohazard container. Okay? Biohazard container, like this. It's a red, with a red bag on it. Okay? So this swabby is contaminated with blood, so it needs to go in there. The test strip is contaminated with blood, needs to go into biohazardous. Okay. The rest of the stuff that stays behind can go into normal municipal waste. The cappy, normal waste, the normal waste bins like this. And the envelope, the empty envelope can go into normal waste. Guys, the disposal is critical because we pay for the disposal. The costs are most expensive, slightly less expensive, and then the municipal waste is the cheap ones. The nice thing about this is you guys get to pay for this as well, including the test strips that you are using. Test strip values between 30 to 50 rand for one. Please don't miss them. Okay, you guys ready? You got the instructions? You can do this?
Yes.
Okay. If you guys get stuck, if you're unsure, if you've got any questions, please ask. We'll come and help. Okay? Go for it.